Good afternoon, everyone, and welcome to this session on the role of SLTs in prisons. I'm really excited to be chairing this today, and I wanted to start off by saying thank you to all of our panelists. So we've got Christina Stanway from Merseycare NHS Foundation Trust. We've got Tracy Forster from the Tees, Esk and Wear Valleys NHS Foundation Trust, which is tough to say. And we've also got our very own Claire Moser from the RCSLT. So thank you to all of you for coming along. And also I'd like to thank all of you viewing today. Thank you for coming along this afternoon. It's already been quite a long day, so thank you. I won't do too much more by way of an introduction for our panelists because I'm positive they'll do a better job than I can, and I won't want to steal anyone's thunder. But I will just briefly go through some housekeeping. I'm afraid for those of you who have already turned up to a few sessions today, this will not be new. But if any of you are just dropping in for the first time, first of all, if you have a question for one of the panelists, please use the questions tab. That means it'll either be answered live, or if we don't get to it during the live session, it'll be answered afterwards. So come back to the conference platform for that. If you have any kind of general comments or you want to share knowledge amongst other listeners, please use the chat tab. Just for everyone's information, we are recording the session, and the video will be made available on the conference platform shortly after the conference. It would really help us all out if you were able to leave some feedback at the end of the session, just to let us know what you liked, what maybe didn't work so well, just so we can make sure it's still good for everyone. And finally, there will, and I never thought I'd be able to say this in a professional capacity, there will be a secret code revealed at the end of the session, which you can enter into the Challenge Hub for some extra points. So do keep an eye out for that. For now, though, I will hand over to Christina. So over to you.
Great, thank you very much, Mark. By way of introduction, my name is Christina Stanway and I'm the Assistant Director of AHPs at Merseycare Foundation Trust. And I just want to acknowledge that today's presentation has included contributions from Emma, who is our professional lead in secure care, and Bernadette, who is one of our speech and language therapists working in one of our prisons. Next slide, please. So just in terms of a little bit of context, Merseycare supports, from a secure care pathway perspective, prisons, high secure, medium, low, and out into patients' homes and community forensic services. So what we're going to talk about today is experiences of individuals across that full pathway. Next slide, please. So just to set a little bit of context, we know that there's no systematic study of speech language communication needs in the prison population, but we anticipate that it's a fairly high prevalence when we look at studies of other populations and some of the studies that have been done in the prisons. So we know that between 66% and 90% of young offenders have difficulties, and that's likely to go through into adulthood. And we know that early problems with pragmatic language has been linked to psychotic experiences in later life. There's three main things that we look for in terms of context. The first one is underlying conditions such as ADHD, autism, learning disability, undiagnosed DLD, sensory needs, so some of those pre-existing communication conditions. We also think about mental health conditions, in particular things like schizophrenia, have a lot of processing and attention difficulties, disorganized speech, people in catatonic states. That's quite a significant barrier to effective communication. The impact of trauma and depression impacting motivation. And then thirdly, we think about some of the mental health interventions that might impact on individuals' ability to communicate. So certain medications may have side effects. We know that for ECT treatments, there's some lasting impact on communication. And what we see in our prison populations is individuals that often fall into all three of these categories. Next slide, please. So what we see for our people who are in these services is some significant stigma that's associated with that. So what we often hear from staff is he doesn't show remorse, he doesn't learn from his mistakes, he comes across as quite rude, he doesn't listen, He's always getting into fights. Some of the things that you see presented there are often not just for people who are in the prison services, but for people with underlying mental health conditions, described as dangerous, unpredictable, difficult. From the person themselves perspective, they will say things like, the ward I'm on, or the unit I'm on, or the cell I'm in is always noisy. People around me use words I don't really understand. I'm not really sure if people are joking or serious. I feel embarrassed. I have to say everything 3 times. Nobody seems to get me. And what I feel in terms of a speech and language therapist is this is our role to really understand and unpick and support these individuals, because this stigma doesn't have to be the case for these people. Next slide, please, Claire. Thank you. So in terms of being a speech and language therapist, what do we look for and how are we assessing people? So we're trying to understand what's their receptive language, what's their expressive language, what's their pragmatic skills. And so we're trying to assess those things in a prison setting where often we have no access to pen and paper. You could keep going, please, Claire. Thank you. Often we need to be able to build a relationship. These are people who perhaps have had no stable relationships or very challenging relationships. And how do we build relationships with individuals? Well, we build those relationships through interaction. So if you could just show the next couple of images, Claire. The reason I'm showing these is these are patches, and this is often what we're communicating through. And so how do you build a relationship when all you can see is somebody's face at a distance? And if you just show the last image on this slide, Claire, what often happens with hatches is when they open, the individual on the other side is having it opened for a specific need to be met. So they're giving medication, they're giving food, they're telling you that they're taking you somewhere. The hatch is not often open for somebody to have a social interaction with somebody. And so the person on the other side is not expecting that social interaction and perhaps doesn't know what to do in that situation. So we're trying to assess somebody's abilities through a hatch when that's not their expectation of why that hatch is being open. You could go to the next slide, please, Claire. Great. And so often with the hatches, or the windows, or however they look in your services, when they're open, we're told to stand back away from them because people might reach through them. And so not only are we trying to communicate through that very small hatch that you saw in the image, but we're perhaps doing that at 3 feet away from people. So how would you assess eye contact when you can barely see the eyes? How would you assess someone's body language when you might only be able to see their face? People understand proximity as part of their interaction. But how do we assess whether they have normal ability, sorry, not normal, ability from a proximity perspective to interact with somebody when we're already setting those boundaries ourselves? We might not be able to hear them properly because we might have to be quite a distance away. And how do you have a functional communication conversation with somebody when you're at such a distance? And actually, what might often happen, if you could show the next image, Claire, is you're probably not on your own either. So you're probably also with the ward manager or a caring assistant or a prison officer. And so suddenly you're there to assess someone's ability with an audience. And that puts quite a lot of pressure on the person who you're assessing to interact with a group of people. And we know interaction in groups can be quite challenging. And so what we often see is people not presenting the best version of themselves. We often don't see what skills they truly have because the way in which they're being assessed is different. And that can often lead to diagnostic overshadowing, overdiagnosing people, misdiagnosing people. And it really presents with all of that stigma, and it just reinforces that difficulty in that interaction. Next slide, please. So I wanted to spend a minute going, so why do we do it? It's really difficult to really understand someone's communication skills in these services, but why would we want to do it? So one of the quotes that I've put here in the middle came from Lord Ramsbottom a number of years ago. And it says, I have to admit that in all the years I've been looking at prisons and the treatment of offenders, I've never found anything so capable of doing so much for so many people at so little cost as the work that speech and language therapists carry out. And if you could load the quotes around the edges, um, I can tell people how I feel. Staff now stop and talk to me. I've built relationships with people around me, got more confidence, I feel heard. I can make choices. I'm being given more opportunities. And the bottom one is a quote from a patient I've recently worked with who said, for the first time, I've been in the system for 20 years, and for the first time, I have hope. I have hope that this is not it for me, that now people really understand why I behave the way I behave, and I understand why I behave the way I behave. And I've got strategies. I now have hope that there's something more than this that I'm capable of. And that's why we do it as speech therapists. It's why we go through the challenges of all of the barriers to work in this field. Next slide, please. So if there's any take-home message from me today, it's that it is really difficult to work in these services. But the bonus is you get to be really creative in how you work. We're building on the evidence base in a really exciting new clinical area. And most importantly, in this population, we really give hope to those people when we are able to unpick their communication skills and support them. And then if you want any more information because you're interested in this field, or you're working in this field and you're stuck, because sometimes we get stuck because it's tricky, please reach out, because this is an ever-growing network of speech therapists and we really want to support each other. Great, thank you. And I will pass you over now to Tracy.
Thank you, Christina. I was nodding along all the way through your presentation there. I think it was like, yeah, absolutely. So my name is Tracy Forster. I'm an associate consultant speech and language therapist working in health and justice in the northeast of England. If you'd like to go on to the next slide, Claire. Just to give you a bit of context, as Mark said, I work for Tees, Esk and Wear Valley NHS Trust, which is a bit of a mouthful, TEW for short. We provide mental health services across a range of prisons across the northeast and Yorkshire in England. And I'm part of Achieve Health and Justice team that have now 20 speech and language therapy posts across community services and prisons. And I'm going to share with you a little bit in terms of the SLT prison workforce, some of our journey, what we've learned along the way and how we've grown and developed, and hopefully help you to kind of navigate how you build services, because it is, as Christina said, an ever-growing area. So our journey started back in 2017 in health and justice, where we had one speech and language therapist who was working in liaison and diversion. And then in 2018, we got our first prison posts, which was me in HMP Home House, which was part of the Drug Recovery Prison Project. So it was a MOJ and NHS England project at the time. And we had half the speech and language therapist working into a specialist unit at HMP Durham. So we've now got 11 prison posts, and we cover a range of prisons, so from high secure down to open prisons, both male and female establishments, and it's growing all the time, which is really exciting. Next slide, please. So one of the questions I get asked all the time is, where have you got your SLTs from? Because most of them, funnily enough, don't come with a prison background. So I guess the answer to that question is kind of changing all the time. But initially, I think some of our staff came from some secure settings, so secure hospitals, a lot of our staff came from community learning disability services. So often where people were working with people who might have presented behaviour that challenged services, that kind of thing. So I guess that kind of fits quite nicely, and that makes sense in terms of the fact that a lot of our prison population are neurodivergent. However, a kind of growing area for us is the kind of adult acquired therapists. And again, it makes a lot of sense, because when you think of a prison, it's a population like any other population. And those people within that population develop acquired conditions. Many of those people will have a mental health background. So that makes, again, a lot of sense. We've also had therapists that have come across from child specialist services, so neurodiversity services, CAMS, those kind of services as well, that bring, another perspective to it. We have got a couple of staff who are newly qualified, so straight from university, and we have got one international SLT who came across from America to join us, which was fab. But having said that, that can be a little bit of a challenge for us working in prisons, because for prison vetting, people have to be a resident in the UK for a number of years in order to get clearance. So bit of a kind of, but when we talk about transferable skills, obviously, absolutely, all of those are highly relevant, and that's not a kind of an exhaustive list. We will absolutely consider anyone with all sorts of background in terms of the transferable skill set that they've got. Next slide, please. So when I was putting this presentation together, I asked our therapists, why did you choose to work in a prison? And I've got some really interesting answers. First and foremost, it was about the client groups. And again, Christina's already mentioned it's a really diverse population. The prison that I work into has 1,200 men, and within that you've got people who are an aging population, you've got young people who've come in, you've got people who are neurodiverse, you've got people with all sorts of presenting communication needs and backgrounds. So number one was the client groups. The second thing that people talked about was having support from an SLT lead who works in the justice setting and kind of understands prisons and prison settings as being really key. Our therapists also really value being part of MDTs, which is not a mandatory drug test as they refer to it in the prison. I mean, multidisciplinary teams in this context. So our therapists sit within the mental health teams, so they're part of that MDT, but they're also part of a wider prison MDT, which involves obviously officers. It might involve neurodiversity support managers, a whole range of people within that. A big driving force for people was seeing the patient outcomes, about people being able to engage in treatment and recovery work. And again, another strong theme was about fair access to justice. So obviously some of our service users might be on remand, might be going to court, but also fair access to like recovery work and drug treatment and those kind of offence work, things like that as well, because obviously the communication difficulties that people are experiencing can be a barrier. And then a big one was creativity, which I know Christina's already mentioned. You have to be quite creative if you work in a prison. There are obviously barriers around engagement for people, but there are also barriers about the setting, which is about the regime and be able to access people, and security barriers and physical barriers like you say, hatches and screens and things like that. And IT systems, lots of multiple different IT systems that don't always work together. So you do have to be quite creative and quite good with being able to think on your feet. So our therapists really value that. Next slide, please. And then just to reassure people, we haven't got it entirely, we're not sorted in Tube. We still have difficulties in terms of getting the right people, being able to recruit, particularly to Band 6 posts. But we are working, again, trying to use that theme of creativity with our HEIs around getting students cleared to come into prisons early on and identifying them so that there aren't barriers around there. We've done a conference at York St John last year, which was, again, all about SLTs in justice and the justice field, and those kind of creative opportunities to engage with students, so the meet the expert sessions, lecturing, that kind of thing. And also, we often get asked to provide shadowing opportunities for other SLTs who aren't working in the justice field, just to come and see what is it like, because sometimes people's perceptions of prison don't match the reality of it. And then obviously we're thinking about some of the posts that we have. So, could this be a part of a rotational or a floating post, and the role of associate practitioners within that as well. Next slide, please. And then finally, just to think about what keeps us working in this field, why do we stay working in prisons? Again, core themes for the staff were around support and supervision, and not just clinical supervision, but that kind of management supervision, reflective practice within the teams, supervision if there's been an incident, all of those layers of supervision, and being part of one team. So whilst therapists are kind of solo within the team that they work in, we are one team. So I really value that you can literally pick up the phone and say, can I just run this past you? What do you think as a fellow SLT? Really valuable. One thing I really appreciate, again, is that team development, having that hive mind where you can come up with new resources, think about systems and processes together, learn from each other, because themes that are relevant in youth justice will also be relevant in liaison and diversion, will also be relevant in the prisons. And we have a really robust, in-depth induction into the prison service, where people get to spend lots of time shadowing other professionals, but also other SLTs who are working into prison. We are really lucky that we are valued and we're included in the kind of service structures within our trust, but also within the prisons as well. And we are really lucky that we have got good opportunities to develop our skill sets. So some of our therapists are also DBT therapists, etc. And obviously the developmental posts where you can progress from being a band 5 into a band 6 and things like that. So that's just a bit of a whistle-stop tour of where we've been up to. I wouldn't, pretend to have all the answers, but I guess these are some of the core themes that hopefully might be applicable for growing the service further. And I will hand you back over now to Claire, who's going to talk to you about training.
Hi everyone. So just to introduce myself, my name's Claire Moser. I'm the policy advisor at the RCSLT, and I lead on our influencing and lobbying work around youth justice and adult justice. But today I'm going to talk to you about a project that I've been leading on, which is very exciting. It recognises that not all prisons have access to speech language therapy, and the project looked at how training could help bridge that gap. So why focus on training? Well, like I said, not all prisons have access to speech and language therapy. And equally, I think both speakers before me have been quite clear in highlighting the need. So we know that over 60% of people in prisons and across the justice system will have the speech, language and communication needs. Yet we know that not all prisons have speech language therapists. And equally, in prisons, we know that many health and care staff have never received any training to help them identify or to respond to people who have communication needs. And we know that this knowledge gap has real consequences. So misunderstanding, frustration, conflict, poor adherence to treatment plans, and even inadequate care can all result when staff misinterpret or they don't understand someone's communication difficulties. At the RCSLT, we have lobbied for a long time to get speech language therapists into all prisons. And we've also, alongside that, lobbied for all training for all staff who work across the justice system to help them identify and understand people with communication needs. And I was in a conversation with NHS England, East of England, and they highlighted to me a gap with their staff, a gap around training and communication and neurodiversity. And when they said that to me, I identified an opportunity for us to make a meaningful change. So we proposed developing a new training package. And I say it's new because it's not normally something at RCSLT that we would do ourselves. So this training package was designed and delivered by speech and language therapists. The aim of it was to help health and care staff in prisons to identify and respond to people with communication needs with more confidence. So this was recognising that these prisons did not have a speech and language therapist in them. When I presented the idea to NHS England, they loved it, they backed it, and they gave us funding to go ahead and develop the training. So in spring of this year, we recruited a group of prison experienced speech language therapists to design and deliver all of the core elements of the training. And we wanted the training to be practical, wanted it to be accessible, and wanted it to be realistic. It was about giving staff confidence. So it's about confidence to spot someone may be struggling, and confidence for them to know how to adapt their communication in response to that. And the timeframes were tight, with completion dates at the end of the year. So our training package consisted of 2 tiers. So there was a tier 1, which was the box, the e-learning, which was about giving someone foundational knowledge. And then there was a tier 2, which was providing in-depth knowledge. So I'm going to talk about each of the tiers in a bit more detail. So many of you hopefully will know about the box. It's the RCSLT's existing e-learning. And within this project, we had the opportunity to update it, to refresh it, and to restructure it. We added new resources. So we're thinking about how we can support learners in their day-to-day interactions, thinking about what resources might be helpful for them to take away after the training. And importantly, the box is for anyone working across the criminal justice system. It's not just aimed at prisons, whether you work in youth justice, liaison and diversions, probation, or staff it is relevant for. But within this project, obviously, we were looking at prisons. And then the second tier, which is the face-to-face training, this was new and exciting that we developed over the course of this year. And the training really builds on the foundational knowledge that the learners will have gained from doing the box. So it includes interactive sessions, it's got scenarios to help staff think differently. It's all thinking about how we can strengthen staff confidence and equip them with strategies to improve their care. We held 2 pilots. So one pilot was in HMP Wayland and one was in HMP Chelmsford. So they were held in September and November of this year. And for those of you who don't know, one's category B prison and one's category C prison. So we're quite interested to look at how staff across the different prisons would respond to the training. So we recognised from the beginning that the evaluation would be absolutely critical. I was really keen to get feedback from across the 2 pilot sites to help shape our thinking and to make any further refinements we wanted to make to the training itself. So we held debriefs with our trainers, we collected evaluation forms, and we held one-to-one interviews with the delegates. And the one-to-one interviews I found really helpful. The staff in them provided real insights into how they were applying the training already into day-to-day interaction. And the results spoke for themselves. So our evaluation forms were quite clear. Staff said they found the training relevant, they found it engaging, they found it directly applicable to practice, and they particularly viewed the interactive elements and the practical strategies, which is really nice to hear. Both sites reported very high agreement that staff left with a better understanding of communication difficulties, and the staff at both sites said that people were more confident in recognising if someone had a communication difficulty and what they could do as a consequence. And as part of the interviews also, we were collecting evidence of immediate impact because we wanted to know how quickly it was being felt. And the administrative staff, so the health and care assistants, told me that they were already simplifying letters and they were checking clarity of the letters with colleagues, which was really nice to hear. Nurses and other healthcare staff said that they were adapting questions in their interactions. They were using fewer words, they were allowing more processing time, and they were being more patient as well, kind of things that we would take for granted, but staff were saying they were now trying that and it was having really good impact. Some staff also shared with me that they were sharing the learning with absent colleagues, so health and care staff who couldn't be at the training itself, they'd shared the learning with them, which for me was really nice, that there's that motivation to share the knowledge more widely across health and care teams. I think I do need to pause and say the aim of the training is not to replace speech and language therapists. So we're really clear it's about extending their reach. We know that not all prisons have speech and language therapy, but actually by training staff, it's the first step to raising awareness and hopefully building and expanding the number of SLTs across prisons. So what next? Well, the project doesn't stop. So we've done the 2 pilot sites, we've done the evaluation. The next phase of the project is to roll out to the other prisons in the east of England. So this is where our funding comes from. So we're going to roll out to the other prisons. Unfortunately, there's a bit of a lack of SLT in this region. So I will be doing some lobbying alongside us to raise the profile of speech language therapy. The box will be made available. So in the new year, please do keep your eyes out. We'll be launching it formally, the go live with all its sparkly content. So we're very excited about that. But our work's not stopping now. So just because we're targeting on the east of England, this is the beginning of the journey and not the end. So I will be engaging with the other regions. So looking at other regions who equally don't have speech language therapy in prisons, thinking about, do they want to take part in our training offer? Is that something that'd be useful for their staff? And then, of course, as I do work in policy, my role will continue to advocate for, influence and lobby for speech language therapy in all prisons to make sure that everyone with a communication need can be understood. So that is our end goal. So that's a bit of a whiz tour through our training package. But yes, thank you very much for listening. Shall I hand back to Mark now, please?
Awesome. Thank you so much, Claire. And thank you to Christina and Tracy as well. That was 3 really interesting presentations. And also thank you to all of you watching. I've been sort of keeping an eye on the Q&A and the chat, and it's clearly an incredibly engaged group we've got here. So if it's okay, I'm very aware of time, so I'm going to move straight into Q&A. But unfortunately, with the, I guess the caveat that I don't think we're going to be able to cover all of them today. But like I said at the start, we'll do our best to answer all of them at a later stage as well. So it's not kind of, if it doesn't get answered today, it won't at all. But if I go for the most highly voted one, and I think this is quite an interesting question because I think Christina and Tracy, you mentioned creativity within your work. And the question is, how do we meet the communication needs of people in this setting, especially considering the limitations posed by locked doors, hatch communication, or periods of patient seclusion?
Do you want me to start? I think working in a prison, you have to be really collaborative, and often it's around relationships, and I think sometimes that's about knowing the right people to speak to about certain things, knowing how to kind of facilitate opportunities to speak to people, which may be so. Sometimes it might be about, you know, if someone, can I see them can I see them in the room with the glass screen? Can I see them in there? I think there are opportunities there. I think one of the things I found is that people are really keen to engage in speech and language therapy. The service users absolutely get it. So often they're advocating and saying that I really need to see my speech therapist because this is actually really important to me. And I think part of it is also about who you know within the prison context who can also enable and facilitate some of those opportunities as well. So things like the neurodiversity support manager can be key in some sites around how you do that. And you know, sometimes it is about a piece of paper put up against a screen and, you know, adapting communication screens to be right, you know, more talking map style, or you know, let's think about an orientation piece of work here because we've got somebody who's struggling with memory and context within, you know, within a segregation or a seclusion context. So I don't think there's one answer. I think it's partly about who you know, thinking about, well, what are the opportunities, and certainly being creative about where you see people, whether that's, you know, you go and see them in industries, you go and see them in education, you go and see them wherever they are. But also, like I say, thinking about how you can adapt things and adapt our resources to fit the context.
Yeah, I think just to add to that, Tracy, for me, it's about compassion and caring and a positive relationship. And actually, I will often say to therapists, well, how do you build a relationship with the people outside of work? Well, you talk to them about things that they like, and you find some commonality, and you listen to them, and you don't just half listen, but you really listen. And often for me, the men that I work with in the prison have never had anybody that's actually really listened and then cared and then remembered what they said and come back and had a follow-up conversation. And so for me, from a creativity perspective, it's thinking about how do you build relationships generally and then applying that. And that isn't usually how we would assess people. We do often have activity-based assessments, whereas this is a conversational-based assessment. And for speech and language therapists, we're good at conversations, so it's leaning into what you're good at.
And that's probably why people are keen to engage, isn't it, in SLT? I mean, I came from a secure hospital setting where we had to work quite hard at getting people to engage with us, whereas in the prison I find it's more the opposite of it's miss, can I work with you? Which is fabulous. So often they're advocating, I think, as well.
Awesome. Thank you so much to both of you there. And I think there's sort of a question here as well that it feels like you've already started to touch on. But that was a question around how open are prisoners who have not previously had input to working with a speech and language therapist. And I wondered if you wanted to kind of briefly touch on that.
Yeah, I think it depends on their experiences, because they may have seen somebody else working with speech and language therapy. So they go, oh, that seems like a good thing, I'll do a bit of that. But for some people, it is quite difficult because they don't know why you're speaking to them, and actually saying to them, I'm trying to understand how much communication you understand, actually can put them on the back foot. So for some people, it is really difficult to engage, but that just comes with that. For me, continuing to build the positive relationship. So it might be that actually you're just saying good morning to them every day as you walk past them, and then they're like, oh, she speaks to me every day, or maybe I'll have a detailed conversation with her. I think if you're in seclusion, that is more difficult because there's no ad hoc interactions. It's always meaningful and purposeful and need driven. But it is just about repetitive kind of trying. I don't know, Tracy, if you've got any golden nugget.
Don't know if that was a golden nugget, but I think also being really upfront about what the purpose of it, of why you're working, they've been referred, and also what the benefits are of completing a communication assessment, for example. And often people are concerned about, well, who's this information going to be shared with? And again, it's those conversations about actually this information is for you, and it's for who you choose to share that information with. Because often people are concerned about, well, is this going to be held against me? Is this going to be used in terms of extending my sentence or things like that? So I think being really open and honest about that, and giving people control over how much they choose to engage and who they share their information with.
Awesome. Thank you so much. I'm afraid we are at our time limit. But I wanted to thank all of you for engaging with this and asking those questions. Like I said, we will answer as many of them as we can after the session. And I believe now all that remains is to say thank you to our panelists. Thank you as well to all of you for coming along. And I think you should now see the secret code, which is, I'm sure, why everyone was here, really. So yes, thank you all very much for coming along to this. I hope you found it as useful, informative, and engaging as I did. And I hope you enjoy the rest of your conference. Thank you, everyone, so much.